All right, it's 47 past the hour. Joining us now, Director of the Office of Management and Budget, Mick Mulvaney. Very good to have you on the set with us. Thank you for coming in.
Happy to be here on a beautiful, warm, sunny day. According to the Congressional Budget Office, it's sunny and 74 outside.
The sun is, well, coming up behind the blizzard. So we are looking at these CBO numbers. Republicans have in the past supported CBO numbers. Is it safe to say you have in the past supported CBO numbers?
Well, I think what you're seeing is something we have talked about in the past as Republicans, which is, look, you have to sort of rely on the CBO to count money.
Right.
Because that's why it's there. We've been very critical in the past about their ability to count coverage numbers, insurance coverage numbers. I think just 3 years ago, for example, it was back down in 2013, Obamacare was already around, and they did an estimate then of what Obamacare would look like this year. And the number that they estimated at that time, not 20 years ago, not just 3 years ago, there'd be 24 million people on the exchanges. Today it's 11.5. They missed by 50% over a window of just a couple of years. It's really, really hard to do this. We don't even try to do this at the OMB. That's how difficult it is. CBO, good at counting money in and out, numbers, taxes, policies, and so forth. Not so sure they're the best folks to count insurance
the
coverage.
question that's been asked over and over and over again, though, is are people going to lose health care coverage? Are people going to be uninsured under Trump care or whatever you want to call it, this new plan or this repeal and replace? And Republican after Republican who supports it has just failed to answer the question. And now the CBO comes out with this report saying 24 million Americans, 14 in the next year. And we're supposed to also believe that these numbers are way off and that nobody's going to lose their health care? Can we be honest?
I don't think we're dodging the question. I think what we'll be saying is there's another more important question.
No, again, actually, there's the question that you're dodging.
No, if you give me a chance, I'll explain the question.
All right, answer that.
The Democrats have always seemed to be focused on coverage, all right? And they covered me. I was
so
on.
Was the President of the United States. He has been very focused on
If
coverage.
you let me finish, just a second. I was covered. I was on Obamacare. I was on the exchanges as a member of the House, okay? I had the same plan that somebody who makes a lot less than I did at the time would have. I had a $12,000 or $15,000 a year annual deductible. I could afford it. How could the person who makes 1/5 of what I was making ever afford to go to the doctor? And that's where we're trying to drive the conversation. Yes, you sit there and talk about coverage, but coverage is not the end. People don't get better with coverage. They get better with care, and that's the conversation we are trying to have. So you ask me about coverage, I say, look, that's fine, but let's talk about how to afford to get actual care.
Look, that's fine, meaning yes, there are millions of people who will lose their coverage.
But if you have coverage that doesn't allow you to go to the doctor, what good is it in the first place?
Well, most of these coverage cuts, right, are coming in Medicaid, okay, which, yes, obviously has limitations. There are issues going to doctors. However, it is a system. It is not that individual market. It is not the Obamacare exchanges that we've talked so much about. And it is a lot of people, and it is why Tom Cotton is so concerned about this bill, for example. And again, I keep going back to this disconnect. Paul Ryan, the Speaker of the House, is making the same argument that you are. He's saying, look, this has never been about universal coverage. This is about universal access. This is about cost. But the President of the United States has been out there saying the opposite. He says, we're going to take care of people. No one is going to lose their coverage. He tweeted in 2015, I will not cut Medicare, Social Security, or Medicaid. Isn't he breaking that promise?
And what I think he heard yesterday in the White House was people who have coverage but don't have care. And I think maybe the president is now around to understanding the important thing is allowing people to go to the doctor when they get sick. And Democrats took all of this credit for giving people coverage, but ignored the fact that they had created this large group of people that still could not go to the doctor. That's what's important to the president. How do these folks who supported him, how do these folks who need this assistance, how do these folks actually get to go to the doctor when they get sick?
And how do you answer the criticism that this plan amounts to tax cuts and money to wealthier Americans who maybe didn't vote for the president?
We promised at the very outset we were going to repeal all of the taxes, okay? And that's what the proposed bill does, at least all the taxes you can. Keep in mind, when Obamacare got created, some of it was put in with 60 votes back before Ted Kennedy passed away. So there's things we cannot undo during reconciliation. You all talk about that on the show. It gets a little bit deep down in the weeds. But everything we can repeal with 50 votes, we do. We do it in such a fashion that we think allows these folks we've just talked about to be able to afford to go to the doctor. Who cares if somebody else benefits? Why do you have to have a system that punishes somebody in order to help somebody else? We think we've created a system that saves money and allows more people to get affordable health care. why would it be bad if folks benefit from a small tax reduction at the same time?
Do you agree with a lot of Republican senators who say the House bill would have to be changed substantially to get 50 votes in the Senate?
I agree that every senator believes that every House bill needs to be changed substantially in order for it to pass the Senate.
But do you agree that that's the case? It's going to have to change at least somewhat to pass the Senate?
We are working on getting it through the House. I think we're very, very close to getting a bill that's through the House.
Do you have 216 yet in the House?
You know, I haven't actually run the final numbers yet, simply because the framework bill, there's a couple of ideas floating around. I think there'll be some proposed what they call resolutions in the Budget Committee either today or tomorrow, depending on the weather, to have some small changes to the bill. Remember what the framework bill is: as much repeal as we can do and as much replace as we can do. There have been some really good ideas from across the political spectrum, at least within the Republicans in the House. So if those end up getting added to the bill and don't change that basic framework, the president will still be there. But I don't think we're in a position to start counting votes until we know what that bill looks like.
So the CBO report, do you agree with the facts that it presents? Are the facts correct in the CBO report?
Mika, I don't believe the facts are correct. And I believe, I'm not just saying that because it looks bad for my political position. I'm saying that based upon a track record of the CBO being wrong before, and we believe the CBO is wrong now. Let me give you a specific examples why that is, and it's not politics. Go read the report. You'll find out that the CBO assumption, in order to get to the numbers they get to, assume that someone, let's say you're on Medicaid today, okay? The House bill passes tomorrow. The CBO assumes that you will go off Medicaid. Okay? It's a free program, but the CBO is assuming that as soon as the mandate is gone, that you will give up something free in exchange for nothing. That makes no sense, and I think that's where we sort of start saying, look, the CBO really good at counting numbers, maybe not that good at making decisions about coverage.
Okay, OMB Director Mick Mulvaney, thank you very much. Thank you for being on the show this morning. Up next, we're going to get a different take. Two Senate Democrats, Sheldon Whitehouse and Mark Warner, join us here on set. Plus, the latest on this winter storm bearing down on the Northeast right now. Washington is among those cities getting off to a slow start this morning. We'll speak live with D.C.'s mayor ahead on Morning Joe.
Hey, Commander, what's going on? There's nothing going on. We're closing the road. Big blizzard moving in. What blizzard? It's a couple of flakes.
Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.